As someone who delayed childbearing until after I was 40 and then subsequently went through 5 cycles of IVF, but ended up conceiving through donor egg, any information we can get on ways to improve ovarian reserve in the form of egg quality and or quantity, I love to hear about it. So one of the hot topics is the use of intraovarian platelet-rich plasma to help improve or potentially reverse diminished ovarian reserve. Now, there are some studies out there. There are some pilot studies. There are some case reports. There's some opinions on the potential success of intraovarian PRP for diminished ovarian reserve. But the article that I want to talk about is from 2024, evaluating the effects of intraovarian PRP on ovarian response in patients with diminished ovarian reserve, a systematic review and meta-analysis. And this is from Fertility and Sterility, which is the journal for the American Society of Reproductive Medicine, or ASRM. So the objective was to evaluate the impact of intraovarian PRP on ovarian reserve and pregnancy outcomes in patients with diminished ovarian reserve. And they concluded this: in patients with diminished ovarian reserve, intraovarian PRP administration is associated with favorable changes in ovarian reserve parameters like with AMH, but no significant improvement in reproductive outcomes, including assisted and unassisted pregnancy and live birth rates, were found. Impact statement. PRP does not significantly enhance end clinical outcomes, including live birth rates and assisted reproductive technology. In the absence of improvement in clinical outcomes, referring to this experimental treatment as ovarian rejuvenation is misleading, and intraovarian PRP should not be recommended as an add-on treatment. Now, I'm a maternal-fetal medicine specialist. I am not a reproductive endocrinology and infertility specialist, but I know what that means. Calling it ovarian rejuvenation is misleading because it's targeting patients who are very vulnerable, like myself, and who are desperate for some fix. So in my expert opinion, for what it's worth, any center fertility specialist who tells you otherwise is misleading you. Now keep in mind, this procedure is also very expensive. So if any fertility center or fertility specialist is routinely doing this in their patients, it is still technically considered experimental, and they should be tracking their outcomes and be prepared and willing to report them. So please do your due diligence and make sure wherever you're going for infertility due to diminished ovarian reserve, like I did myself, make sure that wherever you're going knows the evidence and fully informs you of any science data outcomes we know about these potential add-on treatments.